All right, let's jump right into this deep dive. We're talking about something I bet you never really think about,
Mhm.
getting your blood drawn.
Yeah.
I mean, you sent this document over about it, and it's fascinating. Turns out there is a surprising amount of, like, actual science
Mm.
behind those little vials.
It really makes you think twice about something that most people, I think, just kind of get through, right? And so what's fascinating about this document is how much physics actually plays a role in something that seems so simple.
Yeah. That's
Yeah.
like, I vaguely remember Poiseuille's law from high school,
Yeah.
but this document makes it shockingly relevant.
It's not just an equation in a textbook when you're talking about blood draws. It's like, think about, like, it's easier to drink a milkshake through a wider straw.
Yeah.
And that difference in effort is all about pressure. That's the same principle at play with the catheters that they use when they're taking your blood. So the document really emphasizes that even a tiny size difference in that catheter can dramatically impact the pressure inside your veins.
That makes sense when you put it like that. So a slightly bigger catheter might actually be better for some people. I always just assumed, like, smaller needle, less pain.
That's a common misconception. But the document actually challenges that idea by introducing this concept called catheter to vein ratio, or CVR. And it's basically about making sure that the catheter is sized appropriately for the specific vein that's being used. Because if the catheter is too big for your vein, it can actually create more pressure, not less, and increase the risk of something called hemolysis.
Okay, hemolysis, so that's where red blood cells basically get beat up during the blood draw. Like, the document mentioned all sorts of things leaking out of the damaged cells, which can really mess with your lab result.
Exactly, and that's why understanding that CVR is so crucial. Now, you might be wondering, how fast does the blood actually have to move through that catheter? That's where that Q comes in, and this is what I think the document was really interesting on.
Like they call it the unsung hero of blood draws.
Yes.
So what is Q?
Q represents the flow rate, so how fast or slow that blood is being drawn. And it's entirely controlled by the person who's drawing your blood. Yet, as the document points out, it's rarely talked about with any precision.
So it's all up to the skill of the phlebotomist and whatever they consider go easy that day. Seems like a recipe for inconsistency.
And that's exactly the issue that the document's highlighting, this lack of standardization around flow rate, which can have a huge impact on the accuracy of your results. But there are techniques to kind of mitigate these risks. For example, they suggest something called the pull pause method when you're using a syringe.
Pull pause. Okay, break that down for me.
So imagine instead of drawing the blood back in one continuous motion, the phlebotomist pulls gently for a bit, then pauses to allow the vein to refill, and repeats until they have enough blood. That little pause gives your vein a breather, reducing stress on your cells.
That makes so much more sense. I'm already feeling better about my next blood draw.
And there's more. What about those vacutainers?
Uh-huh.
You know, the tubes they use for most blood draws.
Oh, yeah, the ones they just, like, slap a label on, yeah.
Well, the document actually dives deep into vacutainers, specifically how they maintain constant negative pressure until the tube is full. And that constant suction can be a major culprit in hemolysis if they're not handled properly.
Okay, so I'm intrigued. What does properly even mean in this context? I need details.
One crucial point is making sure the tube is completely filled. Any air left inside prolongs that negative pressure exposure, which can damage cells. They also recommend minimizing the time that the tube is left open after the draw. Even a few minutes can make a difference in terms of cell integrity.
Wow. So much for just slapping on the label. Who knew there was an art to handling those vials?
All about the tiny details, right? And while we're on the topic of handling things with care,
Please tell me shaking those vials like a maraca is a big no-no.
you got it. Rough handling can also damage those delicate cells, skewing your results.
Wow. This is all so much more involved than I ever realized.
Mm.
But if this information is out there, why isn't it more widely known and practiced?
That is the million-dollar question, isn't it? It seems like the document actually touches upon this, suggesting that resistance to change, even when new evidence emerges, is a real challenge in healthcare.
It's kind of unsettling to think about, honestly. Like, how much of a difference could these small changes actually make?
That's the thing about seemingly routine procedures. We often don't realize the impact those small details, both positive and negative. But this document doesn't just highlight the problems, it offers solutions too. And some of them are surprisingly simple.
Okay, I am here for it. Give me the cheat codes for better blood draws.
Well, did you know that even the position of your arm can make a difference? Gravity can actually be your friend here.
Wait, really? Tell me more. Because I usually just offer up whichever arm seems easiest.
Exactly. But imagine this. You're about to get your blood drawn, and instead of keeping your arm flat on the chair, you let it dangle for a few minutes beforehand. That simple act can actually increase blood flow to the area, making it easier to get a good sample.
See, this is the kind of stuff I'm talking about. Simple tweaks that can make a big difference. What about that pull pause method? We touched on that earlier, sounded promising, but I need a refresher on why it works so well.
Right. The pull pause method.
Yeah.
That technique is especially helpful when you're using a syringe. So instead of applying that constant negative pressure, which can be damaging to the cells, it's all about alternating between gently pulling back the plunger and then releasing the pressure to let the vein refill.
It's like giving your vein a chance to catch its breath. So it's gentler on your blood cells, leading to a more accurate sample. Man, I'm starting to feel like a blood draw pro over here. What else should we know about advocating for ourselves during a blood draw?
Communication is key. Don't be afraid to speak up. If you have a history of difficult blood draws, if you're feeling anxious, which, by the way, is totally normal and can even constrict your veins, or if anything feels off at all, just tell the person who's drawing your blood.
It's easy to feel intimidated in those situations, but you're right. Speaking up can make all the difference.
Yeah. And building on that, the document even suggests asking your healthcare providers about the techniques they use for blood draws.
Oh, that's interesting. So we can actually spark a conversation about this.
Absolutely. The more we talk about it, the more awareness we raise. And hopefully, the more these best practices will become the norm.
Now we're talking. Knowledge is power, after all.
Yeah.
But, as empowered as I feel about these practical tips, the document also delves into some, deeper implications of all this. And that's where it gets a little unsettling.
You're talking about that concept of iatrogenic anemia, right? Essentially anemia that might be caused by medical procedures themselves, including blood draws.
Yes, that one really stopped me in my tracks. It makes you wonder how often something like a slightly rough blood draw could have these unintended consequences down the line.
It's definitely a sobering thought. And it really underscores the importance of doing everything we can to ensure that those procedures are done correctly. Because something as seemingly insignificant as a little extra pressure during a blood draw or a tube that isn't handled carefully, that could potentially have this ripple effect on our health.
It's a good reminder that our bodies are these complex systems, and even the most well-intentioned interventions can have unforeseen consequences.
Absolutely. And while this document focuses specifically on blood draws, it really speaks to this larger issue within healthcare. The need to constantly question, evaluate, and refine our practices as new information emerges.
It's about always striving for the best possible outcomes for patients, even when it comes to the seemingly mundane aspects of medicine.
Well said. It's about recognizing that even those mundane aspects are often way more complex and nuanced than we realize.
Absolutely. And this document definitely highlights that complexity. But it also offers a sense of hope, don't you think?
I agree. There's this sense of optimism in its call to action. This belief that by shining a light on these issues, by having these open and honest conversations about best practices, we can continue to evolve and improve the way we care for patients.
And that's a mission we can all get behind.
Yeah.
Reading through this document, I was struck by something else they said. They actually called out that phrase, "That's just how we do things here," as
Wow.
a huge red flag.
Oh, yeah.
It's just because something has always been done a certain way doesn't mean it can't be improved upon.
Yeah.
Especially in healthcare, where we should always be questioning and striving to do better. It's our health.
Yeah, absolutely.
So where do we go from here? What's the takeaway for our listener who's been with us on this deep dive, learning all this stuff about blood draws?
Well, first of all, you've finished this deep dive, so congrats. You've now expanded your knowledge about this routine procedure that most people don't think twice about. But more importantly, now you're equipped to actually advocate for yourself, Ask informed questions at your next blood draw.
Exactly. Remember CVR and that pull pause method we talked about?
Yeah.
And hopefully, the more we normalize these conversations, the more we can collectively advocate for better and safer practices.
And honestly, this is just the tip of the iceberg. I mean, what we've uncovered about the complexities of blood draws, this actually speaks to a much broader theme within all of healthcare. Understanding the why behind even the most routine procedures.
Being an active participant in your own health journey. Asking questions, seeking information, all of that empowers you to make the most informed decisions for your well-being.
Well said.
Well, I think that's about all the time we have for today's deep dive.
Yeah?
But for everyone listening, we want to leave you with one final thought. If something as seemingly simple as getting your blood drawn can have such far-reaching implications, What other hidden complexities might exist in the world of medicine and healthcare?
Lots.
Exactly. And how can we as individuals and as a society keep unraveling those mysteries in the pursuit of better health for everyone? Keep asking questions.
Until next time.